I love
being a nurse.
Being a nurse
at CHAS Health.
At CHAS Health.
One of the things that I love most about being a nurse at CHAS Health is that as we've developed nursing here at CHAS over the years, we've been able to be really forward-thinking and progressive about determining what our patient and our population needs are. And by doing that, we've been able to create nursing roles that are tailored for specific populations where we've noticed health disparities and gaps in care and where equity is not even in the picture. And so we've been able to really tailor nursing roles to address those populations and communities and meet the healthcare needs that were not being met otherwise.
From the mobile medicine perspective, it's a lot of home visits. So our providers from outside clinics, from our clinic within, will place referrals for us to go see bedbound patients, which is really awesome. So we actually go to their homes. We can facilitate video visits. We draw labs. We do med recs. And then the street med portion of that is I'm following about 15 to 17 injectable patients. So I find them on the streets and in the shelters for their long-acting injectables, and they get those once a month. And then we also do a ton of support in all of the shelters around Spokane.
So CHAS, it's way different than my experience as a nurse in the hospital. Day to day, I have a set schedule. So I see as many between 8 to 12 patients a day on busy days. And basically, I'm responsible for triaging patients that walk into the clinic, kind of assessing them, seeing what's going on, how I can help them. Part of my everyday duty is, a main part is patient education, and I love educating patients, whether it's knowledge gaps in medications they're taking, understanding how they work, or simple things like just giving them compression socks and just helping them basically the little kind of nursing interventions that we can do to improve their life, and just seeing that pay off in patients is really rewarding. So I really enjoy that.
Everyday duties include patient outreach. I contact patients once they've discharged from the hospital, and then I look through all of their information from their hospitalization and make sure that their primary care provider has access to that information easily within their CHAS chart. I do what I do because I really want to help people, and a side benefit of working here is I have a really great team. I'm working with other people that want to help people, and so that's really nice.
The job at CHAS has been different from my hospital bedside nursing in that before I was with pediatrics, now I'm with adults, and I get to build a relationship with my patients. I'm really not rushed in what I do. I get to work at the top of my license, and really that relationship is a big deal. And I'm really very independent as far as what I'm doing. The providers that I work with, they take me at my word as far as if I need someone that I need to get put onto their schedule or whatever. We just get to have a really good, cohesive work environment. So between the providers, and I get to deal with clinical pharmacists and our pharmacy team and our MAs. So it's a whole different, more cooperative.
My position is just so varied depending on what the patient needs. Sometimes I'm doing more clinical side of things where I'm gathering like health histories and social histories. Sometimes it's more like a therapy session, and I'm just, providing supportive listening. Other times I'm reaching out to community partners, trying to find, make connections so I can better help my patients connect to those sources. We're taking phone calls from patients throughout the day, addressing their needs, and then meeting with them after their OB and pediatric appointments. And my patient population is anyone who's pregnant and then up to 1 year of age.
Working as a nurse at CHAS Health, we are valued, we are heard for, and they support us with everything that we need professionally. Most of the time when people are heard, they trust you and they're able to tell me things that they're not able to with other people, and I'm able to help them coordinate with the care that they need. I know that patients will be taken care of because everyone at CHAS is dedicated towards our mission to help others in the community.
Every day for me is a little different because I work up the urgent care. So just seeing patients that walk through the door, making sure they're getting the appropriate level of care, whether they are appropriate for us or need to be transferred to a higher level of care, making sure that everyone's needs are met and making sure that they have the resources they need to move through the healthcare system. Meeting the needs of our community is super important as we continue to grow. We're seeing more and more people come in who have diverse needs and diverse backgrounds, and they require the same kind of diversity in their healthcare.
So my life as a nurse at CHAS is very fun and collaborative with a lot of other clinics, primary care providers, and very patient-centered and independent, and just a lot of fun. So this role is different in the way that I independently manage my schedule. I carry a caseload of patients, which I see on a daily basis for the most part, or I call on a daily basis. And my job is to get them connected with primary care and resources in the community, specialists in the community, and just whatever they're really needing, whether it be social determinants of health, which include housing, clothing, food, anything like that. And education, of course, a lot of education to our patients. So what makes me most excited about coming into work is watching our patients improve, like watching their health improve and seeing smiles on their face every day when we are making a big difference in their life.
A lot of my role is just supporting the providers and the care team in general as part of the name Care Team RN, just with their day-to-day life and what they can do to support the patients. I see patients independently, help with their hospital discharges, do wound care or injections, really just kind of go with the flow of the day and see how we can meet patients where they are. It's a really great place to work. It's I haven't ever stayed at a job longer than a year. And so I've been here for 4 years and I really enjoy it because there's good coworkers. Everybody I meet is always happy to help. They're always focused on what we can do to help the patient. There's also just the actual benefits are really good. So PTO, medical benefits, work-life balance has been really great because we don't do weekends in certain RN roles and we don't do holidays, and so that's been great. CHAS really supports growth as well and ideas that anyone might have. They're welcome and willing to listen. I love being a nurse at CHAS Health.